Getting older brings a lifetime of wisdom, strength, and stories. But let's be honest, it also changes how we move, feel, and care for ourselves. Some little hygiene habits we used to do without thinking can quietly slip away. Most of us don't even notice it happening, but doctors do. And those small changes, they can have a big impact on health, comfort, and independence. I remember visiting my grandfather one summer. He was as sharp and kind as ever, but something felt different. His clothes didn't smell fresh, his nails were long, and he hadn't shaved in a while. It wasn't neglect. It was quiet, unspoken struggle. The little routines he once handled with ease had become harder, and he didn't want to ask for help. That's when I learned the signs are subtle, but they matter. If you're caring for someone or aging yourself, it's worth asking. Are you missing the signs? Welcome to the channel. If you find value in conversations about healthy aging, wellness, and living with dignity at every stage of life, you're in the right place. Don't forget to hit that like button if this video speaks to you. Subscribe for more content just like this, and tap the notification bell so you never miss an update. Got thoughts or questions? Drop a comment below. We'd love to hear your story or help however we can. Here are 7 of the most common hygiene-related oversights doctors notice in older adults, along with expert-backed recommendations for staying healthy, independent, and confident. Number 1. Reduce bathing frequency. As individuals grow older, tasks that once felt simple can become physically or emotionally challenging. Bathing is one of the most frequently affected routines. Many older adults begin to bathe less often, not out of neglect, but due to a combination of practical barriers and subtle health changes. Unfortunately, this shift often goes unnoticed until it results in skin problems, infections, or a noticeable decline in personal comfort. Several factors contribute to a reduced bathing frequency. Physical limitations such as arthritis, muscle weakness, or difficulty with balance can make stepping into a tub or standing in a shower feel risky. In fact, the bathroom is one of the most common sites for falls in older adults. As mobility declines, the fear of slipping becomes a powerful deterrent to daily bathing. Cognitive changes also play a role. Individuals with dementia may forget when they last bathed or resist help due to confusion or discomfort. Additionally, a decreased sense of smell or touch can make it harder to notice body odor or skin irritation, leading some seniors to believe they're staying clean enough. Depression and low energy levels, common in late adulthood, can also reduce motivation for self-care routines. The health impacts of infrequent bathing go beyond personal appearance. Accumulated sweat, dead skin cells, and bacteria can irritate the skin or trigger fungal and bacterial infections. In particular, areas like the underarms, groin, and feet are prone to inflammation if not cleaned regularly. Poor hygiene can also increase the risk of urinary tract infections, especially in women. On an emotional level, feeling unclean can negatively affect confidence, social interaction, and overall well-being. Fortunately, maintaining hygiene in older adulthood doesn't require daily showers. Bathing 2 to 3 times per week is typically sufficient, especially if specific areas of the body are cleaned more regularly. Safety is key. Installing grab bars, using a shower chair, and adding non-slip mats can make the bathroom a safer and more inviting space. Handheld shower heads allow for better control and less effort. On days when a full shower isn't possible, sponge baths or no-rinse cleansers are excellent alternatives. Maintaining a consistent bathing routine supports physical health, preserves dignity, and enhances quality of life. With the right tools and adjustments, bathing can remain a safe, manageable, and even pleasant part of daily living, regardless of age. Number 2, poor oral hygiene. Oral hygiene is often overlooked in older adults, yet it plays a crucial role in overall health. With age, changes in dexterity, cognition, and routine can make consistent oral care more difficult. Dentists and physicians alike frequently observe preventable issues, such as gum disease, tooth decay, and halitosis, in older patients, often due to simple lapses in brushing, flossing, or denture care. One of the biggest challenges is reduced manual dexterity. Conditions such as arthritis or Parkinson's disease can make it hard to hold a toothbrush or manipulate floss. As a result, brushing becomes less effective, and flossing may be skipped altogether. In some cases, individuals assume that dentures eliminate the need for oral care, leading to neglected cleaning and an increased risk of oral infections. Cognitive changes, including memory loss and dementia, can also interfere with hygiene routines. Individuals may forget whether they brushed or struggle to understand the importance of oral care. Depression, too, may lower motivation to maintain hygiene habits, oral care included. The consequences are more than cosmetic. Poor oral hygiene is linked to serious health conditions. Gum disease, periodontitis, has been associated with increased risk of heart disease, stroke, and diabetes complications. Bacteria from the mouth can enter the bloodstream and trigger inflammation throughout the body. Infections in the mouth can also impact nutrition. Painful teeth or poorly fitted dentures can make chewing uncomfortable, leading to reduced food intake and weight loss. Fortunately, maintaining oral health in later life is entirely achievable with the right strategies. An electric toothbrush can make brushing easier and more thorough, especially for those with limited hand strength. Water flossers and interdental brushes are practical alternatives to traditional floss. Dentures should be cleaned daily and soaked in an appropriate solution overnight. Just as importantly, regular dental checkups, at least once per year, can catch issues early and ensure proper denture fit. Hydration is another overlooked factor. Dry mouth, a common side effect of many medications, reduces saliva production, which normally helps protect the teeth and gums. Drinking plenty of water and using alcohol-free mouthwash can help maintain a healthy oral environment. Good oral hygiene supports more than just a healthy smile. It helps preserve dignity, comfort, nutrition, and systemic health. Prioritizing the mouth is an essential step toward healthy aging. Number 3, wearing unchanged or unclean clothes. Clothing is more than just a layer of fabric. It's an essential part of personal hygiene, comfort, and self-presentation. Yet among older adults, physicians and caregivers often notice a decline in the frequency of clothing changes and laundry routines. While seemingly minor, this habit can have real health and social consequences if left unaddressed. There are several reasons why seniors may wear the same clothes for multiple days or avoid laundry altogether. Physical limitations such as arthritis, balance issues, or fatigue can make dressing and undressing difficult. For those who live alone, lifting heavy laundry baskets or bending over to use a washer and dryer may feel overwhelming or unsafe. Cognitive decline, including early dementia, may also play a role. Individuals may forget how long they've worn an outfit or lack awareness of odors or stains. Additionally, mental health factors like depression or social withdrawal can reduce motivation to maintain personal appearance. Unchanged clothing, particularly undergarments and socks, can lead to several health issues. Prolonged contact with soiled fabric increases the risk of fungal infections, urinary tract infections, skin irritation, and pressure sores, especially in those with incontinence or limited mobility. Clothing that traps moisture can worsen skin conditions like dermatitis or eczema. In hot climates or in individuals with reduced ability to regulate body temperature, dirty clothing can also contribute to overheating or skin breakdown. On a psychosocial level, wearing unclean clothes can affect self-esteem, limit social engagement, and signal self-neglect, a red flag for healthcare providers assessing functional status or mental well-being. Maintaining clean clothing doesn't require a complicated system. The goal is consistency and simplicity. Rotating outfits every 1 to 2 days, especially undergarments, can greatly reduce skin and odor issues. Creating a weekly laundry schedule, using lightweight laundry baskets, or outsourcing laundry services when possible can ease the burden. For those with limited mobility, adaptive clothing with Velcro closures or magnetic fasteners can make dressing easier and less painful. Caregivers and family members should view wardrobe habits as part of the broader conversation around health and independence. Helping older adults maintain clean, comfortable clothing isn't just about hygiene. It's about preserving dignity, encouraging autonomy, and supporting physical health through daily, achievable habits. Number 4, neglecting nail and foot care. Nail and foot care may seem minor compared to other health routines, but in older adults, neglecting these areas can lead to significant complications. Physicians and podiatrists often see preventable issues like thickened nails, fungal infections, painful calluses, or even ulcerations, all of which can impact mobility, comfort, and independence. As we age, nails tend to grow more slowly, but they also become thicker, more brittle, and harder to trim. Toenails, in particular, are often overlooked due to reduced flexibility or visual limitations. Conditions such as arthritis, poor eyesight, or back problems make reaching the feet difficult or painful. Additionally, those with diabetes or peripheral vascular disease are at increased risk of complications from even minor foot injuries or untrimmed nails, which can quickly develop into infections or non-healing wounds. Another concern is decreased sensation in the feet, a common symptom of peripheral neuropathy. When sensation is reduced, an individual may not feel the early signs of pressure, blisters, or injury. Long or jagged toenails can dig into adjacent toes or shoes, causing cuts and ulcers without the person realizing it. Fungal infections, which are more common in older adults, can go unnoticed and spread, affecting nail integrity and skin health. Routine nail and foot care is essential to prevent these issues. Fingernails and toenails should be trimmed at least once every 2 weeks or more frequently if they grow quickly. For older adults who find trimming difficult or unsafe, regular appointments with a podiatrist or home health nurse can provide safe, professional care. It's also important to inspect feet daily for cuts, swelling, redness, or changes in skin texture, especially in individuals with diabetes. Wearing well-fitting, supportive shoes and clean, breathable socks can further reduce the risk of friction, moisture buildup, and skin breakdown. Moisturizing the feet daily, avoiding areas between the toes, helps prevent cracking and dryness. If a fungal infection is suspected, over-the-counter antifungal treatments can help, but persistent or worsening symptoms should be evaluated by a healthcare provider. Nail and foot care is not cosmetic. It's a core aspect of aging well. Keeping feet healthy helps maintain mobility, prevent falls, and support overall independence. Small, consistent efforts in foot hygiene can have a major impact on an older adult's comfort, safety, and quality of life. Number 5. Inadequate skin maintenance. As people age, their skin undergoes significant changes. It becomes thinner, drier, and more fragile, making it more susceptible to injury, irritation, and infection. Despite this, regular skincare is often overlooked in older adults, particularly when bathing routines decline or sensory perception diminishes. Physicians frequently see the consequences of neglected skin, from chronic dryness and itching to pressure ulcers and delayed wound healing. The aging process reduces the skin's ability to retain moisture and heal efficiently. Oil glands become less active, and collagen production slows down, resulting in dry, flaky, or cracked skin. In many older adults, these issues are compounded by underlying health conditions such as diabetes, vascular disease, or malnutrition, which further compromise skin integrity. Environmental factors like cold weather, low humidity, and frequent exposure to hot water can also worsen dryness and irritation. Another common challenge is reduced mobility. When movement is limited, certain areas of the body, especially those in contact with beds or chairs, are at risk for developing pressure injuries. These can begin as simple redness or irritation and quickly progress to open wounds if not addressed early. Incontinence can also play a role, as constant exposure to moisture and bacteria can lead to skin breakdown in the perineal area, often referred to as moisture-associated skin damage, NASD. A consistent and gentle skincare routine can prevent most of these issues. Daily moisturizing with a fragrance-free, hypoallergenic lotion helps maintain hydration and reduce itching. Moisturizer should be applied immediately after bathing, while the skin is still damp, to lock in moisture. Areas with skin folds, such as under the breasts, in the groin, or around the abdomen, should be kept dry and clean to prevent fungal infections. Barrier creams are especially helpful for individuals managing incontinence, providing protection against prolonged moisture exposure. Routine skin checks are also important. Older adults and caregivers should look for any new rashes, bruises, cuts, or discoloration. Non-healing wounds, changes in moles, or signs of infection should prompt a medical evaluation. Early detection and treatment are key. Healthy skin is more than a matter of comfort. It's a reflection of overall health. Proper skincare supports dignity, prevents complications, and helps maintain independence as we age. Small, daily actions can make a profound difference. Number 6. Improper use of incontinence products. Incontinence is one of the most common yet under-discussed issues affecting older adults. It can take the form of urinary, fecal, or mixed incontinence, and while it's highly manageable, many individuals struggle with how to use incontinence products correctly. Doctors and nurses often see the consequences of improper product use: skin irritation, infections, odor, and a significant decline in comfort and quality of life. There are many reasons older adults may not change incontinence products frequently enough. Embarrassment, limited mobility, cognitive decline, and financial concerns can all play a role. Some may not feel wetness due to decreased skin sensitivity and may not realize a change is needed. Others may try to conserve supplies by extending the use of a single product, especially if they are living on a fixed income. The health implications of this are real. Prolonged exposure to urine or stool can cause dermatitis, fungal infections, and pressure ulcers, particularly in individuals with limited mobility. In severe cases, it can lead to urinary tract infections, UTIs, or even sepsis, especially in those with weakened immune systems. Additionally, odor and discomfort can contribute to social withdrawal and emotional distress, reducing participation in daily activities. Proper incontinence care begins with education and routine. First, the right product must be selected, one that fits well, offers adequate absorbency, and is appropriate for the individual's level of mobility. Ill-fitting products can leak or cause chafing. Skin barriers or zinc oxide creams should be applied to protect the skin from prolonged moisture, especially around the groin and buttocks. Products should be changed promptly after each episode, or at least every 4 to 6 hours, depending on usage. For those with memory impairment, scheduled toileting or prompted voiding can help reduce accidents and reliance on pads or briefs. Having supplies easily accessible in multiple areas of the home, using discrete disposal systems, and setting reminders for changes can make routines easier and less stressful. Finally, it's important to approach incontinence with compassion, both from caregivers and the individuals affected. This is a common medical issue, not a personal failure. With the right products, proper hygiene, and a consistent care plan, older adults can manage incontinence with dignity and confidence, avoiding many of the complications doctors are frequently called to treat. Number 7. Unnoticed body odor or breath changes. Body odor and bad breath are often sensitive topics, especially for older adults. They're easy to overlook and harder to bring up, yet healthcare providers frequently notice them during routine checkups. While sometimes the result of simple hygiene oversights, persistent changes in body odor or halitosis can also signal deeper health concerns. The challenge is that older adults may not be aware these changes are occurring. One major reason for this is diminished sensory perception. As we age, the sense of smell can weaken, a condition known as hyposmia, making it harder to detect subtle or even strong body odors or breath changes. This sensory loss may result in individuals believing they are fresh and clean, even when hygiene routines have lapsed or medical conditions are affecting body chemistry. Poor dental hygiene is a common cause of halitosis in seniors. Dry mouth, pterostonia, a side effect of many medications, reduces saliva production, which is essential for neutralizing bacteria in the mouth. Without enough saliva, bacteria multiply quickly, leading to unpleasant breath. Gum disease, tooth decay, poorly fitted dentures, or unclean dental appliances are also frequent contributors. When it comes to body odor, persistent or unusual smells can result from infrequent bathing, wearing the same clothes multiple days in a row, or untreated incontinence. However, certain medical conditions can also alter body odor. Diabetes, kidney or liver dysfunction, and even some infections can produce distinctive smells that may be more noticeable to others than to the person affected. The key is not just masking the odor, but identifying and addressing the root cause. Regular oral hygiene, including brushing, flossing, and cleaning dentures, remains essential. Seniors should drink adequate fluids, use alcohol-free mouthwash, and see a dentist at least once a year. For body hygiene, maintaining a bathing schedule and changing clothes regularly can help reduce odor buildup. If new or persistent changes in body odor or breath occur, a healthcare provider should evaluate the underlying cause. These signs may be subtle, but they matter. Addressing them early can improve comfort, social confidence, and even catch medical issues that might otherwise go unnoticed. In aging well, even small details like breath and body scent deserve attention, because they're often clues to overall health. Maintaining personal hygiene in later life is not about perfection. It's about proactive care, accessible tools, and informed routines. These small daily acts of self-care have far-reaching effects: improved physical health, reduced hospitalizations, preserved independence, and better mental well-being. Consistency is more important than complexity. Whether you're an older adult or a caregiver, focus on building sustainable routines and seeking support when needed. There is no shame in adapting. It's a sign of strength and self-respect. Aging gracefully isn't passive. It's active, intentional, and rooted in knowledge. With the right strategies, every person can continue living with dignity, confidence, and wellness at any age. Thank you so much for watching. It truly means a lot. If you found this helpful, please like, share it with someone who might benefit, and don't forget to comment below. I'd love to hear your thoughts. And if you haven't already, hit that subscribe button and tap the bell so you never miss a new video. Until next time, take care and keep living well.